So there's no such thing as a silly question. You can ask us whatever you want because we're the ones who know what's going to happen in the OR and you don't. One question we've gotten is, will getting breast implants stop a bullet from me if I was ever shot in the chest? And interestingly, there is a case study of this happening. In Canada a number of years ago, when a woman was shot at close range by a handgun, bullet went through her left breast, got lodged in the silicone implant, and she didn't die. So there you go.
Pretty fascinating. Yeah, so one question I get asked not that infrequently is whether a patient can bring their breast home. And the answer is no, because of a few reasons. One, it's a biohazard, but two is we do send the breast tissue off to a pathologist who then examines the specimen and writes you a note, writes us a note to say, like, what did they find in this breast tissue? Is there an increased risk of breast cancer development from a cell and tissue perspective? So it's important for your safety for multiple reasons, but no question's a bad question. So feel free to ask us anything you want.
Something that I hear frequently is, am I gonna wake up during surgery? And although there's Hollywood movies suggesting that this is possible, it's really not. There are so many levels that you have to basically start to wake up from the anesthesia that we would know that was happening way before you would be conscious. So we'd be able to give you more medication. Now, what can happen is that after the surgery is over, some patients, when they wake up, they're still on the table and we're taking the drapes off of them and putting the dressings on, but their memory might suggest that, oh my God, there's lights, there's beeping noises, there's people with masks, there's drapes, and they think that they woke up during surgery. But they actually just woke up when they were supposed to wake up after the operation was over. It's just confusing during that time.
Another common question is whether someone can borrow someone else's tissue, meaning a sister, a sibling, a mom, spouse. We don't do transplants in terms of moving fat from one person to another or breast from one person to another, but that is a common question and actually pretty common. And then the other one is whether people will lose weight after breast reduction surgery. So,
well, theoretically, if we take enough tissue, I mean, there are patients that we do take pounds of tissue off.
That's right.
So after the initial swelling goes down, yes, you might actually weigh less on a scale.
Yeah, I mean, it's not uncommon that we're doing like over 1 kilogram breast reduction, which is 2.2 pounds per side. So actually you can lose weight from these procedures.
It's the quickest diet plan I know of. 3 hours, 5 pounds off.
Will a breast implant set off a scanner at an airport? And that's a common question, but the general answer is no. While there are some breast implants that may have a small chip in them that are used for kind of like serial tracking and things like that, and the patient's informed of that, most implants are silicone based and don't have any sort of properties that would set off an airport detector.
A patient once asked, if I get silicone breast implants, will I float? And the answer actually is that you become a little less floaty. That's because of density. This goes back to high school physics. The silicone is actually more dense than the fat in the breast, and it's a little more dense than water. So technically, the implants would make you sink a little bit, but it's so negligible that you would never notice this. You don't have to worry about sinking if you have breast implants. You don't need extra buoyancy devices. But from a strictly physics perspective, they do make you a little less buoyant.
So breast implants come in a variety of shapes, styles, sizes. A lot of it comes down to your anatomy. So your chest wall dimensions and then your breast width. So, and also your overall goals, like, do you want a lot of upper pole fullness? Do you want cleavage? You know, some people are kind of trying to compare them in terms of cup size, although that's a little more elusive because it's such a non-standardized metric. But in general, you know, people try on breast implants inside of a bra during a sizing appointment, and that kind of gives them a sense of like how full their cup will be. Now, it's not a perfect assessment or metric just because obviously we're placing the implant under your skin, sometimes under the fascia or under the muscle, so that changes some of the mechanics as well. But we don't really do just small, medium, large, or venti, grande type implants. So there is a lot of precision that goes into like implant selection, and then really what your aesthetic goals are. Like what do you want kind of your breast shape to be?
Is there an app I can add oat milk or not? Or?
There, there are apps for actually like kind of doing 3D modeling. A lot of them obviously are very limited, but we, you know, most of them are filled with either silicone's the most common type, and then there's also saline implants, but with the understanding that the saline implants are a silicone shell nonetheless. Right now we have saline and silicone. no oat milk, but you never know. Implant science is a growing field, and a lot of new changes have been happening rapidly. So there's a lot of nice science going into the implant texturing and safety and monitoring.
So we should keep our eye out for the oat milk implant with a shot of espresso.
All vegan.